Welcome to Medical News Update, health research translated into plain English. Today's story: if you have ever been told you have fatty liver, this one is important. A new study suggests fatty liver is not just a liver problem. It may be an early warning signal for the heart. First, a quick refresher. Fatty liver disease, sometimes called MASLD, which stands for metabolic dysfunction associated steatotic liver disease, is exactly what it sounds like. Excess fat builds up inside the liver. It's very common. As many as 1 in 3 adults in the U.S. now has some degree of it. It's tightly linked to extra weight around the waist, insulin resistance, high triglycerides, and type 2 diabetes. For years, fatty liver was treated mostly as a liver issue. Keep an eye on liver enzymes, lose some weight if possible, recheck in a year. But research has been quietly showing that fatty liver is more than that. It may be a signal that the whole metabolic system is under strain. A new study from researchers at Mass General Brigham makes that case clearer. They analyzed 3,637 adults who were part of a large heart study called PROMISE. Every patient had had a CT scan of the heart to evaluate chest pain. Here's the clever part. When you do a CT scan of the heart, you can also see part of the liver. So the researchers looked at both heart arteries and liver in the same image. Just over 25% of the patients, about 1 in 4, had fatty liver visible on the scan. The first finding: patients with fatty liver had more of a particular type of artery plaque called noncalcified plaque. This is the softer, less stable kind. It is the type more likely to rupture and trigger a heart attack. Then, the researchers tracked patients for an average of 25 months. Among those with fatty liver, 4.1% had a major heart event, a heart attack, stroke, or cardiac death. Among those without fatty liver, 2.5% did. After adjusting for other risk factors, blood pressure, smoking, cholesterol, fatty liver was still linked with a 69% higher relative risk of these events. Why does this matter? First, if you have fatty liver, don't think of it as a liver-only diagnosis. Your liver is telling you something about your whole metabolic state. Second, for people with type 2 diabetes, prediabetes, or weight around the middle, this is one more reason to take heart risk seriously. Heart disease is already the #1 cause of death in diabetes. Add fatty liver, and the warning gets louder. Third, the good news. The same steps that improve fatty liver also help the heart. Modest weight loss, less added sugar and less alcohol, more movement, better sleep. Newer medications, including some GLP -1 drugs, are now being studied specifically for fatty liver, and early results are promising. A few important caveats. This was an observational study, not a controlled trial. That means it shows a strong link between fatty liver and heart events, but it does not prove that fatty liver caused them. It is possible that both are downstream of the same underlying problem: insulin resistance. The patients in the study were already being evaluated for chest pain, so the population was higher risk than the general public. The same exact percentages may not apply to a typical person walking around feeling fine. And the absolute difference in events, 4.1% versus 2.5% over about 2 years, is real but modest. It does not mean everyone with fatty liver is heading for a heart attack. It means the risk is higher and worth acting on early. So what does this mean for you? If a doctor has ever mentioned fatty liver on an ultrasound, ACT scan, or even just from elevated liver enzymes, ask the next obvious question: what are my heart risk numbers? Blood pressure, LDL, cholesterol, hemoglobin A1C. Family history. Don't wait for a heart event to find out. The liver and the heart are talking to each other. We just need to listen. That's today's medical news update. Share this with anyone you know who has fatty liver, prediabetes, or diabetes. Until next time, stay curious, stay healthy.